Whenever anybody does seem to question the current narrative, they get accused of all sorts of things. So I've said previously, I have no skin in the game myself. I'm not trans. My children aren't trans. I've only worked with a few trans patients. I have a number of trans students, or a few trans students. For me, the question is, generally speaking, as a psychologist, I want to make sure that whatever level of care or nature of treatment that we're giving to anybody is based on solid principles, that somehow we have a good sense that it will help somebody. And
Yeah,
I don't think that is necessarily the case with how we are dealing with trans kids, for example. And as an instructor as well, I want to be teaching the right thing. So, for example, I've taught about J. Michael Bailey, who wrote The Man Who Would Be Queen, numerous
yeah,
times over the last 15 years. And ever since I spoke with him over a podcast earlier this year, I've changed the way I teach because I've got a better sense of his motive. He was, of course, called everything under the sun, and I don't think the derogatory terms hurled at him are fair. I think Alice Dreger, the worst she called him, she said, I think he was a clod, an insensitive clod, I believe is
yeah,
what she called him.
yeah.
But she knew, she looked into him, that he didn't have malicious intent. So I'm going to ask each of you if you could please say what your interest in this area is, because otherwise people are going to question everything about why you would even come out and not
Yeah.
go along with the standard narrative.
I'm more interested in reflecting on how we as a profession, psychotherapy profession, have failed, particularly young people. How is it that the culture thinks that the primary treatment for being transgender or being gender dysphoric should be medical treatment when we know that that's going to cause the sorts of harms that I've already mentioned, sterilization, lifelong dependency on hormones and so on. So how is it that we've allowed the discourse about it culturally to be taken over by that medical model when actually we've got something really seriously important to contribute? So I'm starting from that position of self-criticism, if you like, that there's a kind of collective madness shared by us psychotherapists where we tend to identify with this dissociation from the body, really. So it's as if we don't see the body. We only see the person's subjective sense of who they are. And there's a kind of madness in not seeing the body at the same time. For me, gender dysphoria is about the person's inner sense of who they are being dysphoric with their bodily sense of who they are. And I would want to start with that. Start with the dysphoria, not, yes, I must affirm your subjective sense of who you are, if that involves denying the body. So I think the trans affirmatory lobby have unconsciously and unwittingly channeled this generation into a load of unnecessary surgery and medical treatment. And I think my profession, our profession as psychologists, we've been complicit in that because we wanted to be nice. We don't want to offend people. We want to virtue signal to each other. And we don't want to repeat the horrible mistakes that we made with gay people of pathologizing them. But to be gay, you don't need surgery and you don't need hormones. So I think we've let down this, particularly this young generation of trans kids. And so I'm concerned to try and understand how that's happened. And I include myself in that. My own internalized fear of being transphobic led me to let down one of my patients who, I've mentioned him in this chapter. I won't go into the details about that here, but it's in my other paper, The Seventh Penis, where I try and explore what went wrong in that therapy. And I think we're all working under a cultural constraint here, which is not helpful for anybody, least of all the trans kids themselves.
Okay, thank you. And Miranda?
Yeah, I agree with much of what Bob says. I don't think that the situation is particularly helpful to the children that are being labelled as trans kids. I'm very sceptical about the existence of trans kids. I did some research, albeit it was based upon pieces that were written in the Daily Mail, but the Daily Mail itself does systematically have a very thorough way of covering these cases, which of course it writes about in its usual very mawkish way. What it allowed me to do was to quickly research and examine the narratives of young boys and young girls who were being described as trans kids. And with the boys, it was all about behaviour that was based upon cultural sex-based stereotypes. So it was boys who wanted long hair, they liked pink, they wanted to dress up as princesses. And with the girls, it was very different. The girls who were transitioning were older, and they were old enough that they had already made up their mind about their sexual orientation, and they were lesbian girls, and they were looking to transition into men. And that seems to be quite a common issue that we have. And really what I'm seeing is that the way that children's preferences for cultural stereotypes or cultural sex-based stereotypes are being interpreted that the child is transgender. And we like to think that we're very, very progressive and that we've reached this understanding that our biological sex does not determine our personality. We seem to have reached this position with the case that for most people that applies, but for a select number of people, their personality determines their sex. And I think it's very dangerous. And I think that there is an enormous problem that exists that we can't even have a conversation about this without being accused of transphobia. And I think if you look at the people that are doing the accusations of transphobia, it is across the board. But you will find that the anger of younger transgender people who feel aggrieved at their particular predicament is in no way being tempered by what I would suggest is absolutely appalling. In fact, completely stoking the flames and doing whatever you have to do to the beehive to get the bees to come out as pissed off as you can by the older trans people who are essentially making the situation far worse than it needs to be.